Epilepsy Awareness. The learning outcomes. You will demonstrate an awareness of what epilepsy is and the recognition of different seizure types. You'll be able to support children experiencing seizures, ensuring their safety and dignity. Demonstrate awareness of the importance in observing and recording seizure activity. Recognize possible trigger factors. You'll demonstrate an understanding of the epilepsy and of the emergency management plan. Raise awareness of the impact of epilepsy on a child's life and understand the need for balancing risk and achieving quality of life. Raise awareness of the possible educational implications of the condition. What is epilepsy? Epilepsy has been defined as a tendency to have recurrent seizures. These seizures are also referred to as fits or convulsions. The chemical balance in the brain is upset and there is abnormal firing of nerve cells. But one seizure does not constitute epilepsy. It's a common condition. It affects one child of school age in every 242. More common in children with a learning disability. It's approximately 22 times higher in people with a learning disability have epilepsy. Some important points. It's a common serious chronic condition. There are approximately 42 different types of seizures. Can develop at any age. However, it's diagnosed most before the age of 20 and after the age of 60. And it's very individual, specific to the person. SUDEP, or sudden unexpected death in epilepsy. Sudden death with no obvious cause. Can occur with or without evidence of a seizure. It's estimated that approximately one person per 1,000 people with epilepsy in the UK die as a result. What causes epilepsy? In 60 to 70% of the cases, the cause is unknown. Some known causes can include birth injury, head injury, stroke, brain hemorrhage, brain tumour, meningitis or encephalitis. Both conditions affect the brain. Drugs, alcohol. Potential triggers: flickering lights or photosensitivity, lack of sleep, tiredness, stress, overexcitement, missed meals, high temperature, and in girls entering the mental stage, missed or late medication. Classification of seizures. Seizures can be divided into two main groups. The groups are generalized seizures and focal seizures. Generalized seizure types: tonic-clonic, typical absence, atonic, tonic, myoclonic. The tonic-clonic seizures, most common of the generalized seizure types, may have an aura leading to the tonic-clonic stage. This is how the patient feels. Loss of consciousness, usual duration 1 to 2 minutes. May follow on from a focal seizure. The tonic phase: muscles contract, the body stiffens, and the child falls to the ground. The child may become pale. Their breathing may be irregular and around their lips may appear blue. Saliva may dribble from the mouth and can be blood-stained if the tongue has been bitten. Incontinence may occur. The clonic phase consists of short, sharp, rhythmic jerks caused by alternative contraction and relaxation of the muscles in the trunk and limbs. Periods of relaxation become more frequent and prolonged. Muscles relax and the body goes limp. At this stage, the child will still be unconscious. Slowly, they will regain consciousness but may be groggy and confused. Management of tonic-clonic seizures. What you need to do is stay calm. Assess the child. If it's safe to do so, move them if they're in danger. Protect the head. Loosen any tight clothing. Remove glasses. Time the seizure. Observe and record. Once the seizures are finished, Aid breathing by gently placing them in the recovery position, in other words, turn them to their side. Stay with the child until recovery is complete. Reassure, reorient the child, tell them they've had a seizure. Allow the child a period of rest or sleep afterwards if required. What you'd never do is try to restrain or restrict the child's movements, put anything in their mouth, give the child anything to eat or drink until they have fully recovered. Typical absence seizures. Generally a childhood disorder. May look blank and stare, lasting for a few minutes. Eyelid fluttering or blinking may occur. May have minor facial movements or head drop. Able to continue normal activity almost immediately afterwards. The management of absence seizures, what you need to do, record the time of day and the frequency. Reassure the child if necessary. Repeat the information the child may have missed. Atonic seizures or drop attack. There's a sudden loss of muscle tone. The child falls heavily to the ground. May last only a few seconds. Able to continue normal activity almost immediately. Tonic seizures. Muscles contract. Body stiffens, trunk, facial muscles and limbs. Results in falls. Normally a quick recovery. The management of tonic and tonic seizures. Check for injuries as may need medical attention. Stay with the child, reassure them. Myoclonic seizures. Quick muscle jerks usually of limbs, however the head and shoulders may also jerk forward. May be one or both sided. Usually seen in specific childhood epilepsy syndromes. Frequent soon after waking. Short-lived, so it's difficult to tell if consciousness is impaired. The management of myoclonic seizures. They may be unsteady and fall, so check for injuries. Stay with the child until they recover fully. Reassure the child. Focal seizures. Abnormal discharge confined to one part of the cerebral hemisphere. Can spread to the rest of the brain, resulting in secondary generalized seizure. Consciousness may or may not be impaired. Symptoms depend on the area of the brain involved, so it could affect the hearing, vision, smell, or taste. Symptoms can last from seconds up to about 1 to 3 minutes. Can present as mumbling or uncontrolled laughter, sucking, chewing or swallowing movements, plucking or removing clothing. May wander around as if drunk. In the management of focal seizures, what you must do is stay calm. Guide the child from danger. Stay with the child until recovery is complete. Reassure, explain anything they may have missed. What you don't do is restrain the child. Act in a way that could frighten them, such as making abrupt movements or shouting at them. Give the child anything to eat or drink until they have fully recovered. Now, recovery position. You place the child, if they are breathing normally, unconscious, right, in the recovery position, so they're laying flat on their back. You put the feet together. The arm nearest to you, you just let drop to one side so it's at right angles to the body. The hand farthest from you, you bring over the chest and hold it against the side of the face. This then protects their face from the ground surface when they roll to the side. The leg farthest from you, you raise at the knee so that the foot is flat on the ground. And this you use as a lever, just pulling it slightly towards you. Your patient's body will roll forward on their side. You then adjust the upper leg so the hip and knee are bent at right angles. This prevents your patient from rolling on their stomach. Open the airway, check for breathing. Now you place something over them to keep them warm, in other words, to guard against shock. Call for an ambulance if you think the child needs urgent medical assistance. The child may be has any breathing difficulties following a seizure. If it's the first known seizure, seizure continues for longer than normal. One seizure follows another without the pupil regaining consciousness. Following a seizure, after the seizure, the child may be confused, have no memory of what's occurred, subdued, tired and sleepy, have a headache, concentration is impaired, or it could be hyperactive. Care following the seizure, have a clear understanding of what's occurred. Observe breathing, colour, any injuries. Be aware of the post-ictal states. Offer support and counselling as appropriate. The seizure management plan. Seizure management plan should be in place and available and agreed by the parents and carer, the doctor, a children's epilepsy nurse specialist. The original copy is always to travel with the child. Updated yearly or more often if required. Be aware of who's responsible for first aid. The parent and carer should also be informed of the seizure as soon as possible. Record the seizure. Seizure management plan will provide description of the seizure, usual duration of the seizure, trigger factors, management of seizure, a description of the seizure and its duration, indications of the use of emergency medication and the initial dose of emergency medication, and who usually responds to the emergency medication, who is trained to administer the emergency medication, consent to treat, educational implications, a change in behaviour can be observed, seizure activity, side effects of medication, memory may also be affected, can experience some loss or difficulty retaining information, the role of school staff and carer. Be aware of children with epilepsy. Have as much information as possible about specific seizures from the parents or carer. Observe any unusual behaviour and liaise with the parents or carer. School staff may be the first to pick up on the seizure. Absences, or it will be daydreaming. Have a positive attitude towards the condition. Avoid treating the condition as an illness. Recognise, record changes in mood, behaviour, academic achievement, social interaction. Risk assess for particular activities. Observe and record details of seizures. Promote communication with parents. Minimise embarrassment. Care of the other pupils. Reassure the other pupils present. Type of seizures they witness will have a direct impact on how they cope. Do not keep epilepsy a secret. Sport activities. Most children with epilepsy should be able to fully participate in most activities, ensuring adequate supervision is provided. Each activity and each child should be considered individually. Special considerations and precautions should be discussed with the parents. Social life. The following increase of the risk of seizures: excessive alcohol, lack of sleep, disturbed sleep patterns, missing meals, forgetting to take medication, recreational drugs. Other points to remember: normal seizures run into their course and the child recovers without the need for medical intervention. Children should be given the opportunity to participate in the same activities as their peers, promoting independence, confidence and self-esteem. Anyone can have epilepsy, but can you tell who does? I don't think so.